It's been a month since the Supreme Court overturned Roe versus Wade, and many are still wondering what comes next. This morning, we're sitting down with Dr. Paula Cody, an adolescent health expert with UW Health Kids in Madison, who says she's fielding more and more calls from patients asking about contraceptives. Dr. Cody, good morning, and thanks for joining us.
Thank you.
So first of all, what are you hearing from these patients who are calling in? What information are they looking for?
Well, at the John Stephenson Teenage and Young Adult Clinic at UW Health in Madison, we've had a pretty dramatic increase in calls from patients and their parents or guardians with lots of concerns about availability of either contraception or their menstrual management options since the Dobbs decision a month ago. There are hormonal and non-hormonal options that we use both for period control and for pregnancy prevention, and all these options are still available to patients in Wisconsin.
Right, and so what are the options that patients still have available when it comes to preventing a pregnancy?
There are a number of options. There's different kinds of pills that you can take every day. There's a transdermal patch that you place on your skin and change once a week. There's a vaginal ring. There's a shot that you get in your body every 10 to 12 weeks. There's an implant that can go into your arm, which lasts for 3 to 5 years. And there's a number of different intrauterine devices or IUDs that can last anywhere between 3 and 12 years. And of course, the barrier methods for pregnancy prevention, the internal and external condom, are also all available.
And lastly, are emergency birth control options still available?
Emergency contraception, which you take after intercourse, those are still available, and there's a number of options there as well. There's Plan B, which is available over the counter without a prescription. There's a medication called Ella, which does require a prescription from a healthcare provider. And there's a copper IUD that requires a visit to a clinic and someone who is trained to insert IUDs. This copper IUD has to be done in a clinic. And these are all still available. And all of these options have pros and cons, and it's important to talk with your healthcare provider to see which is best for you.
All right, well, Dr. Cody, thank you so much again for joining us this morning. Definitely a very important and timely topic right now.
Thank you for having me.
Still ahead.